from the security post to the CT scan, we went through a whole gamut of projects done in just 365 days. And as CMD, I must commend you because being an insider, I know the challenges that most chief executives pass through.
I want to especially appreciate you for the patience who started this facility tour of the University of Benin Teaching Hospital or the main hospital complex. We wanted to showcase what we have and what we have been doing and how we have been able to put things in place to be able to cater for the teeming population of not only Edo State, but for the South. We're looking at universal health coverage, and we're trying to care for everybody that has a health challenge. So the purpose of this facility tour is to take you through a first-hand view what the University of Benin Teaching Hospital has, the facilities. We started with the security, where we showed you the renovated, previously dilapidated and abandoned police post which we built up, and it's fully equipped and also has a full personnel of policemen who are posted to us at the Commissioner Police. We also did a light up of the whole hospital complex. We put solar lights in the residential areas. We also put solar lights in the clinical areas so that the safety of our patients, our staff, is paramount. We also took you through the accident and emergency complex, which is the biggest accident and emergency complex, I think, in Nigeria. We have 65 bedded A&E unit, and we can cater for all manner of emergencies. You must remember that the University of Benin Teaching Hospital is a tertiary healthcare institution, so we deal with complicated cases. We have specialists from all cadre of medicine, dentistry, we have lab scientists, we have pharmacists, everybody that is who in the medical profession, we have them in the University of Benin Teaching Hospital. We took you through to the patient waiting area, which was a more conducive and better area with comfortable chairs, better ambience, and even if your loved one is at the accident and emergency, you could have a comfortable place to wait. From there, we took another tour to the refurbished, expanded, renovated mortuary complex and gave it a better ambience because we looked at it and said the final or the last bus stop should not be in a state of dilapidation. Previously, we had to pass through a bush to get to the mortuary, and then we decided that no, let's refurbish it. And that is what you saw. We built a walkway with flowers, lighting, and you need to look at it and see it at night. It's really beautiful. From there, we went to the mortuary itself, where we are giving more dignity to the dead. We put a viewing room where you can actually view your loved ones in a private setting, so there can be no error in who you take home for the final rites. That viewing room was constructed, and we expanded the mortuary from initial 72 chillers to 460 chillers. The ambience of the building, the surroundings was done up and total overhaul, including a brand new roof. From there, we looked at the challenges of most of the people who pick their loved ones from the mortuary complex. And the major challenge is some are traveling, some want to go and do a speedy burial, especially if it's a young person. And some, for reasons best known to them, may not have a place to give the last rites. And that is why we now decided to build a brand new complex which we labeled the Multifaith Center, which you saw, and it has chairs and a pulpit and an area for you to give the last rites. You just bring your loved ones there and bring who you want to minister, and that's why it's called the multifaith center. From there, you can carry the loved ones to a place of their final rest. From there, we now moved to the renal unit. We upgraded the renal unit and we decided to look at services for premium clients and express service. You don't want to wait on a long queue. You want to have expedited action to carry out your dialysis, and we set up a brand new premium service unit for our esteemed clients and for those who are in a hurry and do not have the patience for a long wait time. We also have enough space for regular patients to do dialysis. The premium unit is just one, and the one for regular patients is quite a lot. From there, we moved to the Pediatric outpatient clinic, which before was dilapidated, and we made it children friendly. We put chairs, we put a play area, and there were no restrooms there because it was something where they just used the surroundings. And we built a toilet at the back in addition to renovating the complex and putting a more befitting nurses station there, complete with air conditioning. After the pediatric outpatient unit, which we call the POP, we now move to the oxygen unit. Oxygen shortage is now a thing of the past in UBTH because we met an abandoned oxygen plant. It was covered with bush. We cleared it and we reactivated it, revitalized it. And now oxygen shortage is a thing of the past in UBTH, which you verified. And you could see so many oxygen cylinders. If you had come a little bit earlier, you would have seen them in the process of filling those cylinders. So at any given point in time, we have oxygen available for use by patients within UBTH. From the oxygen center, we now moved to the geriatric ward, and you saw for yourself firsthand. Some of our esteemed elderly patients, some were playing Ludo, and some were reading in a place, an ambience that is so good, that was donated to us by one of our esteemed clients, one of our patients, Barrister Richard Honorable SAN, who decided to graciously donate that center to us. That was an abandoned place within the ward, which he refurbished, equipped, and kitted for the elderly. You saw it by yourself, how they were in a very relaxed atmosphere. Sometimes the atmosphere helps with the healing. From the geriatric library and lounge, we moved to the radiology unit, where we saw the 160-slice CT scan, which was donated to us by the Japanese government, courtesy of the federal government. There are only 3 of those machines in the country, and it does state-of-the-art imaging to help us with diagnosis. From the radiology department on the 160 slice, we moved to the special investigation unit, which is a brand new structure. That structure houses all the investigative units in the hospital, and we have a very large waiting room. We decided to improve on the ambience and make the patient experience something akin to what you see outside the country. Our patients are paramount, our patients are esteemed, and we do not joke with their comfort, and that is what we are aiming to do. From there, we moved to past the refurbished dental center, and then we moved to the Oncology center, the cancer treatment center, which is also known as the Oncology center, which was donated to us by the federal government. And that center, you saw for yourself a patient being treated for cancer of the breast. I just also want to put on record that we have a cancer health fund in which people who have cancer can apply to this fund. And if you are approved, it's not for everybody, it's for indigent patients who are battling cancer. One of the goals of the federal government is to make certain treatments available for the poor. And if you qualify, a fund and a wallet is given to you, on which you can access your cancer treatment in the university Benin Teaching Hospital. From there, we moved to the main theater, where we decided to do up a small room. It's a little bit small, but it's very effective. So most of the surgeons, they stand for long periods of time doing operations. Some operations can go as much as 12 hours. And after the 12 hours, they have to come back in again and face another surgery. And where do they sit and relax? And that is why we did up the pantry where they can relax while they are getting the next patient ready. They can have a cup of tea and have a little refreshment, re-energize themselves before they move back into the theatre for the next surgery. Now, the purpose of this first phase, this is the first phase of the facility tour. The Honorable Permanent Secretary, Federal Ministry of Health and Social Welfare, Ms. Daju Kacholom, ably represented by the CMD of the National Orthopedic Hospital, Dr. Philip Odaga, was here to see what we are doing, verify, and see how this impacts positively on patients' welfare, patients' experience, and patient encounter. Tomorrow, we'll be going to one of our outposts. University of Benin Teaching Hospital has 2 outposts. We call them the comprehensive health centers. One is in Udo, that's in Obia Southwest, and the second one is in Ogbona. The one in Udo is the one we're focusing on for now. We'll focus on Ogbona later in the year. What we have done there is, from a total dilapidation, we have taken it to a better experience, and we are improving the quality of life of patients in underserved communities. We are not stopping to get the very best for our people. Sickness does not know age, it doesn't know gender, it doesn't know tribe, it doesn't know creed, it doesn't know tongue. When you are sick, you are sick. And when you are sick, you need a competent facility to manage you. The University of Benin Teaching Hospital is that competent facility, in that it's a one-stop center. Whether you are looking for neurosurgery, whether you are looking for cancer treatment, whether you are looking for dental services, whether you are looking for eye services, whatever it is, whatever the problem you have, it's a one-stop center. We have the staff, the trained staff, the experienced staff, and we have the facilities. We also have the equipment which you have verified in this facility tour, because it's all about verification. You have seen it with your eyes, and you can see that we are more than ready to take care of anyone, irrespective of who you are. Our doors are open to everybody 24/7. We try as much as possible to give you the best experience. So on behalf of management, I want to thank all of you.